So this is the workflow with Katana in my practice. I have a prime scan and we do some intraoral scanning. We send it over to our prime mill. I do dry milling. With dry milling, we could do that in, between 8 to 12 minutes, for instance. I usually don't do speed milling, but you can. And we have Katana blocks, and we use a speed fire for sintering. So this was a mixed bridge single crown. And like I said, I 3D print. This is a Flexera temporary printed on a Envision Tech printer. And site development, I'll talk a little bit about that, but pontic development is a huge part of, my bridge cases as well. But the occlusal view, I think you could really appreciate how challenging this case would have been if we didn't do some kind of orthodontics first. So this is before Invisalign, after Invisalign, and then the Katana restorations on the model and in the mouth. So here is the whole workflow. The biggest improvement that you can make in terms of the aesthetic outcome of these milled restorations is post-mill contouring. And the contouring and the way that light refracts off of line angles, it really kind of helps improve the aesthetics, makes these restorations just look so much more natural. In terms of being able to see what I need to prep before I do it. And so this is our wax up. This is our current dentition. And when we see it kind of overlaid over the natural teeth, we can start to begin to appreciate, hey, I don't need to prep that much on the facial 6, but I need to prep heavily on the lingual of 6. I don't need to prep a lot on the incisal edges of those anterior teeth. So these are all things that I value about the digital approach to these cases. So she had existing bridges 6 through 8 and 9 through 11, clearly stained, fractured, and needed to be redone. She had no intention to treat her lower anteriors, but thankfully she agreed with my recommendation, did Invisalign. This was only 9 months of Invisalign. And what it allowed me to do was be ultra conservative with my preparations, especially around those lower anteriors. Kind of a challenging case in terms of Invisalign, but we were able to kind of move the roots a little bit to get the result that we ended up with at the end. So this was done at the prep appointment, literally taking just like a white round stone, creating indentations like an ovate pontic, but then also putting pressure with those temporaries, those 3D printed temporaries. And what I love about the 3D printed temporaries that I don't think I got with the chairside temps is that, really beautiful margin. Here is the case. This is in the green state. That's the top picture. In the green state, now this leads to the next question. You mentioned Katana feels different in what way? So when it's in this green state, keep in mind it's 25% enlarged, first of all. Secondly, it is like a powder material. If you drop this bridge in this state, it can fracture. What I do is very light pressure and very low RPM. I'm doing my initial post-mill contouring. The more you polish Katana, the more pearly it gets. So if you're using a high RPM, it'll start looking kind of like this pearl effect. And it's not quite pretty, especially if you're just cementing it polished. I do that for my posterior crowns. I glaze all my anteriors, but if you might notice that if you've ever worked with any zirconia, but Katana in particular. But I'm leaving kind of roughness, but I'm defining my line angles. I am polishing, and I'm defining some anterior, some incisal anatomy. So this is her smile before and after. Happy patient. We were able to improve her deep bite, improve her overjet with doing the restorations on the bottom as well, and giving her a very conservative, I think, approach to her case.